Wabash General Hospital Emergency Department is staffed 24 hours a day, 7 days a week, 365 days a year with highly skilled nurses trained in emergency medications and treatments. When I was asked to describe a typical day in the life of an emergency department nurse, the first thought that came to my mind was, there is no typical day. No 2 days are the same. A day in the ED is often a roller coaster with many highs and lows. There may be moments of calm, but that can change in a split second. Every ED nurse is accustomed to expecting the unexpected and is always ready and able to jump to action with little or no notice. All ED nurses have heard multiple times, "Oh, you're an ED nurse? I bet you've seen some crazy stuff." And the answer is, yes, they have. But while there are definitely those moments, that isn't what all of every day consists of. Each ED nurse works 12-hour shifts starting at 6 a.m., 10 a.m., or 6 p.m. On average, they will work 3 to 4 shifts per week, including weekends and holidays. At the start of the shift, they head to the nurse's station to take over for the previous shift's nurse. They will receive report from that nurse on any current patients that are in the ED, including all pertinent information and any possible safety or security issues. They will also be given any updates regarding the functions of the department and any other important information that needs to be relayed at that time. After a report is received, the nurse will introduce themselves to the patients, take over any care, perform assessments, and provide any needed treatments, medications, wound care, etc. that needs to be done. Each nurse on each shift is also required to complete a daily checklist of duties to keep the department functioning and ready at all times to provide optimal patient care, including checking equipment for proper functioning, ordering and stocking supplies in the patient exam rooms, just to name a couple. The ED can often be very hectic and fast-paced. At any given moment, a patient or multiple patients at once can arrive by ambulance, by private vehicle, or walk in. The nurse then will triage and assess each one's condition to determine which patient requires priority attention and intervention. The ED nurse sees all types of patients and therefore has a broad range of knowledge about a wide variety of conditions, from minor injuries and non-emergency issues to major trauma, a woman in labor, or a critical patient that requires life-saving measures, anywhere from newborn to over 100 years of age. They are also continually managing multiple patients and keeping an eye out for any patient condition changes or life-threatening conditions that might arise. Throughout the shift, the nurse is obtaining vital signs, administering medications, answering call lights, assisting patients with any needs or requests, answering phone calls, and performing a variety of needed treatments and procedures as ordered by the ED physician. The nurses work very closely with the physicians to coordinate treatment plans and provide care in as timely a manner as possible. The nurses also work closely with other departments in the hospital, including respiratory therapy, lab, radiology, med-surg, and EMS. After the necessary treatment has been provided in the ED, a patient may be able to be released home. But if a patient requires further continued care, they might need to be admitted to surgery, the medical surgical department, or to the monitored care unit here at Wabash General Hospital. Or if a higher level of care is needed, the patient will then be transferred to another facility. Regardless, each circumstance requires the nurse to perform a variety of necessary tasks, including phone calls, paperwork, electronic charting, and notifying family. Also, they will be in communication with the WGH ambulance service to coordinate transportation and care, or perhaps a medical helicopter service if needed. While each day is different as an emergency room nurse, these men and women share many common characteristics: efficiency, focus, empathy, and definitely the ability to multitask and a passion for helping others. And at the end of those busy shifts, the next nurse comes on duty, report is again handed off, and they can then go home to get some much needed physical and mental rest and relaxation.